Hi, I'm Tim Wiedrich, Section Director for the Section of Health Response and Licensure with the North Dakota Department of Health and Human Services. And welcome to this presentation today on cyber awareness and medical facilities. As many of you are aware, there's been a great deal of attention been paid nationally regarding the issues of cyber and some of the attacks that have occurred, but not just nationally, also within the state of North Dakota. Now, before we actually get underway, I do want to let the control room know that we're getting some feedback. All right, we've got that resolved. And I also just want to remind everybody that there is very important that you make sure your microphones are on mute because during this presentation portion, we don't want to have distractions coming from somebody with an open microphone. To be absolutely certain. In addition to that, we'll be holding all questions until we actually get through the presentation portion of this. So to begin, let me express my pleasure in introducing Darin. Darin Hanson is the Director of Homeland Security for the state of North Dakota. And Darin, thank you so much for joining us today.
Thank you, Tim. Glad to be here. And as Tim said, I am Darin Hanson, the Homeland Security Division Director at the Department of Emergency Services. And so grateful to be here today to talk about a really important topic. And I think I'll probably just jump right into it, get us moving on the agenda, and start out with what to do if you become a victim of a cyber incident. And it's very common. We've certainly seen our share here in North Dakota to go along with those national trends. And so the first thing that we'd ask you guys to do is contact the local law enforcement. This truly is a criminal issue. The law enforcement does struggle right now to follow up on all these, but it's important that we are reporting those. Second, after you've notified law enforcement, we'd want you to reach out to the North Dakota State and Local Intelligence Center, and they can help you with a lot of different things as far as maybe getting better reporting, helping you through that conversation with law enforcement. And what they are is a group of state agencies. There's some federal partners there, all formed to one center, and I know you'll get a little more education on that from our next presenter, so I'll skip through that. And then another thing you can do after that, contact your local IT provider, whoever that may be. They may have some tools to help you out, but it may be important for them to know as well so they can help protect other folks on the network. So that's really what I'm here to tell you about, and maybe answer some questions later if you have them for the Homeland Security division here at the state. But otherwise, Tim, I think I could turn it back to you and appreciate you having me. All
right. Thanks so much again, Kyle, for being here. And let's now take a closer look at what some of the medical facility cyber threats actually are. And to cover that with us today is Kyle Emmel. He's with the Information Security. He's an Information Security Analyst with the North Dakota Department of IT, Information Technology. And Kyle's going to be joining us remotely. And I see Kyle on the remote connection. So Kyle, go ahead and take it away.
Can you hear me first? Anything?
We can hear you just fine. Just go ahead and proceed.
Okay. So I need to share slides. I didn't. I was told someone can maybe share them for me, or here I'm going to share screen. I think that's.
Yep, that was our expectation. So we do have a backup if you need it.
That's good. All right. Are you seeing slides?
It's not yet, but it's coming.
Okay. So just to introduce myself, my name is Kyle. I'm one of many parts, like they said, of the NDSLIC, the State and Local Intelligence Center. So it's a number of different state agencies, some federal partners that all work together, and the main mission is protecting the state. So I'll wait for the slide to come up. There's a small lag, so bear with me. The goal of the NDSLIC, or any fusion center throughout the nation, every state has one or more fusion centers, is to take all that information. Some of it we could just say is noise from federal partners, from all the different agencies out there, from state law enforcement, National Guard information, North Dakota Information Technology, Department of Emergency Services, and try to bring that together to make helpful or actionable information. So myself, I represent one of two people that are here just for cybersecurity. And our goal is to protect the whole of North Dakota, primarily critical infrastructure, but really that could encompass, I look at that as just about anything. So if I can get any information to protect your facility, to protect your systems, my goal is to try to get that information to you. So we're constantly looking at vulnerabilities. We're even looking at scanning for North Dakota. But before I get to that, I'll just go over what we provide a little bit. We do have cybersecurity bulletins and alerts. So if we see something coming out, like in the last couple of weeks, we've had everything from the 3CX phone vulnerability that was being actively exploited, or supply chain attack on 3CX systems, Microsoft Exchange vulnerabilities, Felina last summer. Anything that could be widespread, impactful, or we can actually see that there's a number of systems public facing in North Dakota that this would affect, we're going to push out an alert or a bulletin on that. Or if I can find it specific to a single entity, I will reach out to those entities to let them know, like I did last week with PaperCut, a print management software that's largely used in schools and universities. We found the few that were not associated with state government, that were public facing, that potentially could have been vulnerable, so we let those entities know. Presentations, we can come and provide a threat presentation to try to take what is a very complicated topic and even bring it to the low-level users to help them understand what the threats are. You know, it's more than just saying like ransomware is a thing. It's what are the tactics, techniques, and procedures? How do threat actors target you? What tools do they use? What kind of attack vectors could you see? How complex can it be? How well crafted can some of those even phishing campaigns be? And bring real examples. That's one thing we'd like to do here, is to bring real examples that have been observed in North Dakota to you, so that it can maybe help provide that learning opportunity for employees. Intel sources. So at the Fusion Center, and the Fusion Center has many missions. Many of it is law enforcement, criminal-based missions. I'm just speaking for the cybersecurity aspect, but here's some of the tools we use. So first and foremost, we have Data Miner and Mandiant. So Data Miner and First Alert was a tool purchased by the Department of Emergency Services, and Data Miner uses a lot of AI to basically scan the internet, and it looks through all of that noise, and it tries to produce actionable things for us. So a lot of network notifications, a lot of scanning notifications, vulnerability notifications. I've also been able to use it to look for emerging C2 domains, so that we can plug those in to look at the state network as a whole for any communications to C2s that have been notified, or command and control IPs. Mandiant's another thing that we have a license here. Where this comes back to you is with Mandiant and First Alert, especially with Mandiant from the Fusion Center here. Our mission is to protect the state of North Dakota, not just the state network. So where this comes into play for you as critical infrastructure is, if you reach out and communicate with us, we are more than happy to set up monitoring for you. So what that looks like is especially for Mandiant, is to monitor dark web traffic. So any mentions of your domains, keywords associated with you as an organization and entity, we will monitor that, so that if you come up in a dark web discussion somewhere, there's a chance we might be able to catch it and give you an early alert that there's a discussion regarding you or a compromised user, any of that. We send out compromised user notifications every day. So anytime that it's observed against the state network or elsewhere that we can find that hey, you have a user or system that's potentially compromised. We're going to let you know as soon as possible. But I also have to have feedback to know what to put in there. So, I need people to reach out to me so I know what to add and what to monitor for. But we're happy to, and it's free of cost. It's our mission to protect you in the state. So anything we can put in there to help identify. Lastly, we do have access to classified research at the Fusion Center. So this is myself tied in with our federal partner. We could take indicators of compromise, those technical items like you've had an incident, your cyber team has identified a command and control server that was communicating or a specific variant of malware. Anything that can be extracted from that incident is what I want to know about. Isn't necessarily the impact, the business side. That's not what I'm interested in. I'm interested in the threat and how to either help bring you additional context for the incident that you're dealing with, or how to better protect the whole of North Dakota. So if we can see something that's happening, can we potentially reach out and protect others from that specific malware? Nothing that's ever discussed with me past that point deals with the naming the entity or the impact, any of that. I don't care about who it's happening to. I just care about what it is. But there is a lot of additional context I can gain from classified systems, DoD and FBI. Some of it I can't reshare, but a lot of it I can downgrade if there's unclassified portions of it or law enforcement sensitive portions of it. I potentially can discuss that directly with you, the entity, just to help you deal with maybe the scope of the incident. And lastly, something interesting we deal with the two cyber positions here. We are North Dakota Information Technology, so I am an NDIT employee, which gives me access to NDIT systems. So one thing we've done is we've used StageNet, if you've ever heard that term, but it's the entire network of the state of North Dakota, which is about 400,000 devices. And we use that actually as our own sensor. So a lot of times, especially with phishing campaigns, a compromised user in the state of North Dakota, in an entity, a business, private enterprise, we will observe phishing emails from that compromised user coming back towards the state of North Dakota somewhere, whether it's K-12, NDUS. When that's observed, we'll a lot of times within an hour be able to give notification to that entity that there's something wrong with that user. This also goes with just trends.
Yes, I'm in.
What's going on with attack trends in the state of North Dakota. So what I hope to gain from you is, what was the initial access? What systems or software did they target? Anything that could assist us in scanning the rest of North Dakota or our partner state, or our neighboring states for similar vulnerabilities. Is there anything you would like us to monitor for? God forbid you're experiencing a ransomware incident. Would you like us to monitor the dark web for traffic related to that incident? So if they're leaking data, or there's additional talks that are happening on the dark web, do you want us to monitor for that just to assist you in dealing with what's happening? Is there anything I can help in contacting federal agencies? Do you want help? We have established connections with the FBI or with our regional shops, with our ransomware team, or our dark web teams, DHS, CISA. Is there any resources either during the incident or post-incident that I can help facilitate? I'm not personally going to be able to come in and fix things. I'm not the person that's going to make the pain stop, but perhaps I can just help facilitate good resources to make things better afterward, or preemptively. Assessments, can we help you set up federal assessments that could maybe help prevent something bad from happening? Is there anything else I can help facilitate? I'm here to help you as critical infrastructure. That's really my only mission statement. So anything I can do within that, I will do. And lastly, please sign up for our, I don't know if the link is clickable on the slides, but if you go to ND Slick or you Google ND Slick, we have a cybersecurity alert and bulletin sign up. please sign up. If you have a tech team, one or two people, we don't send out a lot. It's not super noisy. We try to keep it only when we have something that's very actionable, very relevant to most organizations. We will send out an alert with, this is what to look for, this is what's happening, this is being exploited right now. And we're generally 24 hours, we're about a day ahead of when it's mainstream news. So we like to try to keep that going. That's it for me. Any questions?
All right, we are going to hold questions until the very end, but Kyle, I do want to just quickly ask you, in terms of this threat assessment, obviously without talking about specific agencies or entities, but can you give us some idea if North Dakota entities have been specifically targeted? And could you also mention, earlier we had some conversation about just the continuous number of sweeps that are happening as IP addresses are being continually mined for vulnerabilities. Could you comment a little bit about that for North Dakota?
Yeah, I can't comment on particular incidents that are ongoing. There's absolutely things just this week that are happening that are highly relevant to this audience. There's no borders in cyber, so it's just numbers, and they can scan IPs. They look for anything, and anything and everything will be targeted at all times. I don't have any good examples of like an exact average, but I can say like a public facing IP is generally scanned thousands of times a day in most circumstances. It's yeah, everything's on the table with threat actors. It's, whether you're being targeted more specific in a phishing campaign, a spear phishing campaign, I can't say, but I would just assume. So I come from intelligence, so I just assume the worst. I'd say everything you're being watched, you're being targeted. Just assume that you are, and then plan for that. What was the second question? I'm sorry.
No, you covered it.
Okay.
Thank you, Kyle.
Yeah, in the assessment piece, I know we're hopefully going to have a new CISA, new federal CISA representative in Bismarck soon. There are some really good assessments provided by the federal government. I've been on a few with CISA, and I highly recommend them. If they can do it remote, they can also do it in person. And the results are just between you and them. It's not publicly available. They come in, it's not going anywhere. It's just between you and the person doing the assessment to kind of help bring out, what things might be, you should take action on to help mitigate. But highly recommend that too.
Thank you so much, Kyle. Let's turn our attention now to medical facility action steps if, in fact, your facility is targeted. And to cover that topic, we have Joshua Kadrmas with us. Joshua is with the Government Risk and Compliance team. He's a lead for that team, and he's with the North Dakota Department of Information Technology. Welcome, Joshua.
Hey, thanks, Tim. Thanks for inviting us to have a conversation with everybody. And I think this is the first step in trying to reduce the amount of risks that we're seeing in our state environment and also to the rest of our state facilities as well. So can everybody see the slides there okay?
We do have your slides.
Okay, good deal. So as Tim mentioned, I'm Josh Kadrmas. I'm the Cyber Risk Analyst team lead for the state IT department. So really think of us as the proactive arm of security. So we're really trying to reduce the risk to our organizations, our state agencies, and also the government entities that reside on our state network. So Kyle mentioned the SLIC, the State Local Intelligence Center, is really state and the private side. We really are on the state side, specifically protecting our state network and really try to protect our citizen data that they're giving us as a result of trying to get state services. So as they're trying to acquire driver's licenses, for instance, they have to give us some state data. So if we compromise that data, guess what? It's not like a Target or Walmart, right? You can go shopping to a different store and make that selection as a consumer. You can't do that as a state citizen. So we really have a moral obligation to really go above and beyond protecting that data. And although we only look at state agencies, I'll say this with Kyle, we still treat cybersecurity as a shared responsibility. So even those of you that do not specifically reside on the state network, but still are a private facility. Anything that we can assist with for ideas on how to be proactive in your environment, please reach out to myself or Kyle, and we will try to get you some information as best as we can. So really, why are health systems a lucrative target? Everything is on the table, as Kyle says. Everybody's vulnerable. It's really the cost of doing business online, right? We could just fold up and not do anything online, but really that's the day and age we live in. And with healthcare, obviously aging systems, it's no different for most other industries too. Look at any other critical infrastructure like pipelines, the electrical grid, all of those have aging systems just because the cost to replace them is huge to do that in within a couple year separation. So that's one piece of it. Difficult financial commitments for your IT budgets. You have competing priorities like anything else. Healthcare equipment is expensive, so to hold up some of that for IT services and applications gets to be a contentious topic as well. And then hacker demands are typically more likely to be met on the healthcare side of things because PHI is very valuable, along with the critical need to get patient care up and running as quick as possible. So sometimes, dealing with the hackers and ransomware type demands, sometimes you just get in that situation where you really don't want to drag out the situation any longer. Your systems are under control of the hackers, and it's tough to make that snap decision and just try to drag out the process. So why is PHI valuable? In the healthcare industry, it's really 32% of the data breaches, as you see here from Safety Detectives, from a graph I pulled here from their website. So medical records, they contain obviously personally identifiable information, but beyond that, it also has a medical record tied to it. So it's more profitable versus just your basic personally identifiable information like a social security number. Now you have some medical conditions tied with it. That information is a little tougher to recover from as a patient, as a customer. So the hackers know that information, unfortunately. And the other thing too is they can also take that information and submit fraudulent claims. We've kind of even seen that here on the state side with the Human Services Department. They even have a Medicaid fraud unit for that purpose too, to try to detect even hacker or non-hacker type of activity when it comes to a fraud type of claim. So that is one reason why PHI is really targeted above and beyond most other pieces of data, along with financial information, of course. So during an incident itself, let's kind of pivot to the actual incident as that unfolds. A tornado is ready to strike the city you're living in. So what are your next steps? Hopefully you have a plan in place, first of all, right? We're not trying to now all of a sudden try to figure out where do we need to go? Do we go to the basement? We don't have a basement. Where do we go to? Those are the things you really don't want to have to try to decide upon in that moment. So as we get past the incident phase here towards the back half of my presentation, we'll cover some proactive tips here for you too. So really the biggest thing is, as soon as you see something suspicious, just like TSA as you're in the airport, see something, say something, right? It applies here as well. Anything that's out of the norm from your computer, it's running slow, you're seeing pop-ups, all of a sudden your data looks different. So in the security world, we call it the CIA, the confidentiality, the integrity, and availability of systems. If any of those three things seems to be a little different than what you're used to, what's typical behavior, that needs to get reported. You want to report that to your experts as quick as possible. Don't try to investigate the incident. Attackers could pivot and spread across that network like wildfire, and the longer you dwell on that, the more damage they could do with your system. So kind of think of it like a kitchen fire. You got something on your burner, you forgot about it. You want to put that out as quick as you can before that spreads out to the rest of your entire house and have to get the fire department involved. So if you're on the state network, we ask you to contact the NDIT service desk. And these are some information numbers and links I can give you as well. And then other entities, we'll cover that in a second here. Obviously, IT support's one of those, but we have some specific steps we'll give to you in a couple slides here too. Another item here too, it's kind of surprise to most people, is you feel like you got to pull the ripcord, right? Because something's happened to your computer, you got to pull the plug, get them out of there. It actually goes against traditional thinking. We actually want you to keep that equipment turned on, because if we have to run forensics or try to get digital fingerprint of what's going on your computer, we can get some information, some breadcrumbs, as we call it, on who that attacker is, and maybe see if that gives us some ideas of who may be causing this disruption too. So that's probably the toughest thing from a cybersecurity education side, is just to not power off the equipment. And then from the IT side, that's where we're going to really kick in our incident response plan. Now, for entities that are on our state network, so public health units, if you're on our state network, state agencies, we do have information security officers within our governance, risk, and compliance team that will reach out to you. If you don't already know about the incident, we're usually the face of security, as we call it. With our 52 team member, we don't want all those 52 individuals reaching out to our entities. We have dedicated security officers that build those relationships and reach out and work with the entity if they're affected by a cyber incident on the state network. And then another area of our security team is the analysis and response. Think of them like the firefighters. They're the incident responders. They want to really contain and eradicate that threat as quick as possible. And we can do some forensics work now, as mature as our cybersecurity team is at this point. For large events, if it affect the entire state, this may even be from the private side and state agency side of things, the government side, we would actually have some work with the governor's office to stand up a joint information center. We may be looking at State Emergency Operations Center. We've been working with Department of Emergency Services with Darin's team too on how does NDIT help in those situations when there's second and third effects from a cyber incident. Maybe it's affecting citizens being able to, secure food stamps, any types of services that they really need to get. That really would be the Joint Information Center handling the communications with multiple state agencies. So each public information officer isn't trying to handle comms both internally and externally on their own. Now, the non-government entity response, really where the SLIC comes in hand here from the private side of things. First thing is contact law enforcement, make sure they're aware of the situation. They may get the FBI involved depending on the situation, the incident as well. Contact the SLIC, as Kyle mentioned here earlier, the Fusion Center with Department of Emergency Services, IT provider, whoever provides your services as an IT. Mostly we call them MSPs, managed service providers. Get them in touch so they understand what's going on, what you're seeing, and what they can do. And ultimately, if you're not sure who to call in that situation, or you're not sure if you should report it or not, I'd always say err on the side of caution here. It's better to be cautious than and have a false alarm than have something actually happen. Contact the Department Operations Center, as you see on the screen there, at 328-8656. One other thing I'll mention here too, there is mandatory reporting when you do have a cyber incident, so keep that in mind as well. Office of Civil Rights says within 60 days, if you confirm a breach that impacts over 500 plus individuals, their records, you have to report that to Office of Civil Rights, or you could face some fines there too. And then the Attorney General's office, per our Century Code, says any breach or incident that impacts 250 state citizen records or higher, those need to be contacted to the Attorney General's office as well, so at least they're aware of the situation. Okay, so I kind of covered the ongoing immediate response, right, as the tornado hit. Now, before the storm actually hits us from a cyber side of things, and it will, unfortunately, it's kind of the day and age we live in, right? I mean, we likely are going to have a cyber incident at some point. It's just a matter of how do we reduce the risk and impacts of those cyber incidents. The good news here is the next few slides will really build your defense in depth for your organizations. The more barriers you could put in front of the hacker, the better. They get frustrated, they'll move on to quick and easy targets, and they'll move to somebody else if they really have to penetrate into your networks, into your data. So here's how you do it. So as far as the reducing the risk, as we mentioned too, it's really the cost of what we are in with the digital world, unfortunately. But trying to take a proactive approach is your best defense here. So here are several areas of cybersecurity that really could put you in a pretty good spot to respond to a cyber incident or prevent it altogether. Hopefully it's the latter of those two. Third-party risk management, it's kind of a newer area in the last 2 to 3 years. Really the hottest area of cybersecurity, I would say, in the industry is looking at your third parties that are handling your data. Maybe they're processing your data. So you really need to scrutinize those third parties to understand how are they securing your data. We talk in the risk world, there's 4 ways to respond to risk. One of them is to transfer it. You can't really transfer that risk to a third party. You are ultimately going to be the one still having to respond to a breach or an incident, not the third party that maybe compromised your citizens or your patients' data. So scrutinize your third parties that are handling or accessing your data. Cyber insurance is a good way to make sure you are able to possibly meet demands of ransomware, although we don't recommend obviously paying the ransomware demands. And I think even the Biden administration through the White House through CISA says too that really the recommendation is not to pay ransomware, as tough as it is. But when you're in that situation, it's tough to say that you're not going to and cave in to those demands too. But cyber insurance is a good way to at least put some experts on your side on how to respond to those type of demands. They also may have ways to do media notifications if you do get into a cybersecurity incident. So they can provide some pretty good services for you too. Penetration testing, this is really trying to poke holes into your network as you're going around your house. Are your windows unlocked? Is the front door unlocked? Do you have a deadbolt? Those are the things that penetration testing can do. And you can have teams inside with your own IT departments do that. We do that regularly here at the state. Or you can hire a third party and see what they're able to get into your networks too. And fortunately, at the end, you get a report and kind of see, where do you have some gaps before an actual hacker would see those same exposed targets. So that can definitely add some proactive pieces for you as well. Governance, not really the cute piece of security, right? But it's the policies. What are your staff required to do when they're handling sensitive data? Are they allowed to use their Gmail account to send data, or are they supposed to use their specific organization accounts? Those type of things. Make sure there's a policy. Make sure your staff sign off on that as they're hired, and then do an annual review of that with all staff too. Usually during performance reviews is a good time to require them to review the cybersecurity policies that you've laid out. And then risk assessments. This is similar to penetration testing. It's looking at your internal and external ways of assessing risk. There is a nice security risk assessment tool through the Office of Civil Rights that you could click on. Don and Tim likely will provide some slides here afterwards too, and this should be clickable for you as well. But this is a good free tool that HHS has provided out there to medical entities handling PHI to just as a baseline, how do you stack up against cybersecurity risks and give you a good chance to see where you should be focusing your efforts on based off that assessment. And finally, this is something we've done with all of our government entities on our state network, all 600 of them. We try to send out an annual, what we call a cybersecurity maturity assessment, where we go through the Center for Internet Security, that's CIS. It's the top 18 controls. So we don't want to send them 250 security controls to answer. It's the top 18. What are the biggest controls that you could put in that give you the best bang for your buck? Multi-factor authentication. Do they have VPN for employees that are working from home? Those really help give us a good idea of how mature their cybersecurity posture is at that K-12 school or at the county, city of Bismarck. How do they stack up? And then it helps us go in front of the legislature to really help get resources for the entire state as well. So that's been a valuable tool for us to be able to just see where everybody ranks at this point in time. Cybersecurity awareness training. How do you train your staff on cybersecurity? So what we do here at the state is we'll kind of look at trends as we start seeing, maybe there are some certain incidents that keep happening. Our next quarterly training will usually incorporate some level of that type of incident that we've seen here at the state. So it's really timely based training for our staff, and they're bite-sized. I think that's the biggest thing that we've seen here. People just kind of groan and moan when trainings come around, and our cybersecurity training was usually 45 minutes just once a year in October. But cybersecurity has got to be something that's on the mindset year-round. So we switched to quarterly trainings, and we make them bite-sized. So they're like 5 minutes in length, 10 minutes in length, and we get 90 to 95% of state staff completing it. So that is maybe one area to focus on if you're outside the state, is just find some quick trainings that people are like, oh yeah, I should probably think about that as far as posting things on social media. and so forth. So that's a good way to train your staff. Phishing tests are another phenomenal way. We send usually 2 fake emails a month to our staff and see who clicks on them. And then we actually, I don't want to say we go after the staff. We help provide additional training for those staff if they fail like 3 or 4 of those tests in a year basis. And then after 4 emails that they fail, we actually bring it up with their agency's HR department, because now, they're just not getting it. There may be a detriment to the data itself. So how do we help them out? But yet we got to realize that it is also a training issue at that point too. And then as far as training itself, a one-pager is a good way to impress upon your staff the most important things that they have to be aware of when it comes to reporting security incidents. So one thing is, we already covered how to report it, but are your staff trained in knowing what to do in the event they find themselves in a potential cyber incident situation? One-pagers like this could be an excellent way to have staff immediately go to this to kind of look at it from a guide. And if you have staff in the office, you don't print things off, maybe it's just a file on their desktop you could put on there too, that's always there. Okay, so now I will turn it over to Natasha Peterson. Natasha is one of my team members on the team, and she leads our business resilience program for the state of North Dakota IT department, and has assisted many agencies in developing some of these items you see here on the screen. Natasha?
Thanks, Josh. Hello, everybody. So as Josh mentioned, I focus a lot on business resilience, specifically on business continuity and disaster recovery. I've been doing this for several years now. So I've done a lot of research. I've put a lot of things into practice. These are all very helpful things to prepare you for responding to any sort of incident, but specifically today we'll talk about the cyber attack. So you want to have your continuity plan. So there's really 2 different. There's a continuity plan, which is what are you going to do while you're waiting for a system to recover. So you want to identify what your alternate procedures are, if there's different ways that you can do things without a system, if the system is unavailable. And if you have that system, if it is manual, you want to make sure that it's actually set up ahead of time and not just, it's going to be on a spreadsheet, but what does a spreadsheet look like? What information do you have on it? You don't, as they say, you don't want to build the plane. You don't want to build the plane while you're flying it. So, so you want to make sure that you're doing that. You'll also want to identify too if your system is a single point of failure. If the system's gone, there really is just nothing you can do. So what is your protocol in a situation like that? For the disaster recovery plan, this is going to come more towards the end. When it's a cyber attack, there's not much you can do to recover until they identify where the threat actor has been, how far back how long they've been in your system. So when can they identify a clean copy of a backup? Once you have that information, then you can implement that recovery and hopefully get back to normal operations. So that kind of leads to making sure you understand where your data backups and your system backups are. If you're with the vendor, make sure that you're identifying what are they doing, where are they located, how often are backups completed, and how long are they kept? How are they protected or safeguarded? So, for instance, a lot you'll hear WORM, write once, read many. So they're immutable. That means you'll write a copy of your backup to your backup system, and that's it. You can only read it. You can't make it do anything else. So even if it's infected, it's not going to get throughout your other backups. It's protected. So those are things that you kind of want to work through as you're developing your plans and just understanding those pieces and how you can protect your own systems. Tying back to the third-party risk management, with the vendors, do make sure if you review your contracts with them, make sure that it covers disaster recovery and business continuity and your data backups. And going further into that too is the encryption. There's a lot of different things that you can look into in that. And you can always reach out to your IT experts, your information security experts, to help you make sure that you identify and protect your data right from the beginning of getting a new vendor or even updating current vendors. You also want to review your plans on a regular basis. at least a year, especially for those critical applications. And determining that criticality is where that business impact analysis comes in. So if one system or one business process goes down, what is the impact on the entire business? With your recovery plans, your continuity plans, that business impact analysis, you're going to identify what your dependencies are. So if this process goes down, what happens downstream from that process? What other processes are affected by that? And reviewing it annually makes sure that you stay current and make changes as needed. The final thing on the list here are the tabletop exercises. So with your plans, you can do this as you're building them. You can do this, of course, once they're completed, but you want to exercise your plans. This is a great opportunity to teach people what your plans are and how to respond, to make sure they know where to go for specific resources. It also helps you identify gaps. So you may have your plan completed and you do the exercise and you find out that you missed a piece. And it's not a big deal. These are exactly what these exercises are meant to do. If you go through it perfectly, it might be a little bit more on the odd side than the norm. So you should always have these learning opportunities. On the next slide, what we have here is a little bit on our recovery time frameworks for IT. These are typical ones. So you've got your RPO, which is a recovery point objective, and this measures how much data you're willing to lose. You don't want to lose any, of course, but how much can you lose in a given period of time? And this usually goes back to your backup. So if you only do backups every 24 hours, typically your RPO is going to be that 24 hours. The recovery time objective is how long can you last without the system? How long can the system be down and not functional at all? So that's where you're going to do a lot of recovery. You're going to do your troubleshooting. That all happens in that time frame. And then once your system comes back up online, you've got a work recovery time. So you've been doing a process manually. Now you got to get caught up and get that new information into the system. You got to validate the functionality and the backup data that's been loaded into your system from recovery. So that takes a little bit of time too. And so with the RTO and that work recovery time, you get your maximum tolerable downtime. Understanding these timeframes helps you identify what your priorities are for a recovery situation. The unfortunate thing is with the cyber attack, it makes these timeframes a lot more unpredictable. You just don't know how long it's going to take to find where the threat actor came into the system and how deep they went. So this, unfortunately, it could take weeks, it could take hours, it could take, the time frame is just, it's unknown. So having these is more of a known threat. When it comes to cyber attacks, sometimes this, unfortunately, is just out the window. But it's a good place to start and to understand for your systems.
All right. Well, thanks, Natasha.
Welcome.
All right. And we're getting to near the end here. So there's 2 slides here left. The incident response plan. This is where I talked about before the storm hits, you want to make sure you have a plan in place. So these are typically what you see in the plans. Mostly this originates from your IT staff. They should be incorporating some business components into this as well, but really laying out, what incidents raised to a certain level where certain individuals need to be notified. What are the roles that are responsible, accountable, consulted, informed, otherwise known as a RACI chart. If you've seen any of those comms plans, make sure you have templates built ahead of time so you're not trying to work on verbiage in the middle of a storm. You have many moving parts happening at that time. That's the last time you want to try to figure out specific messaging to the media or maybe to your staff itself. That's where you create these templates. I also add here the R&B genre, so maybe a good music effort here. But from the security side of things, really steer clear from using the words ransomware and breach, especially when you're working with the media, right? Just as Tim alluded from the top, the media latch onto those words right away, and now you have a front page story. It's the leading news story on your local news or maybe even the national news, depending how large of an incident it is too. So referring to things as we have an incident right now, that's maybe a good starting point. regulatory agencies or even the OCR, Office of Civil Rights, yes, there you may have to disclose exactly what it is, but know your audience and what words that you're using. And then finally, do a lessons learned on after the incident has calmed down, what are the things we could have done better as an organization. And then finally, some information sharing and other resources. Definitely get on Kyle's list there too from the SLIC, their update they send out on things they're seeing in the environment that you should be aware of. Also, there's the Health ISAC. It's Information Sharing Analysis Center. So you'll get regular updates what the Health ISAC is seeing out there on a weekly basis from the industry. So across the country, what are others seeing? They may also have some meetings that you can attend and really get some ideas from other health organizations that are going through the exact same thing the rest of us are here too, with trying to defend our systems, our data, our citizens, and our patients. So there's a few other items there on the list too. Feel free to click on those as you get access to these slides. And if you have any other questions on these resources, just feel free to reach out to me and I can give you some further information on that. Other than that, that is all the information that our NDIT team has to present. So Tim, I will turn it back to you.
All right, thank you, Joshua. And now it is time for the question and answer portion. And so if you've made note of questions as our presenters have been providing the information to you, just go ahead and unmute your microphone and ask your question. Otherwise, please make sure that your microphone's mute if you're not intending to speak. I do want to, just before we move into that, have a quick conversation with Sheri Hardy, because many of you are familiar with our Department Operations Center here at Health and Human Services Department and throughout the emergency response work. I just want to make sure that we're folding in what the role of that organization is. Our organization is part of this. And so here to present that is Sheri Hardy, the Deputy Incident Commander for the Emergency Operations Center here at the Health and Human Services Department. Sheri?
Thank you, Tim. Like Tim said, my name is Sheri Hardy, Deputy Incident Commander for the Department of Operations Center. If your facility is receiving cyber attacks, or if you guys have any questions in regards to any medical facility related items that the Department of Operations Center could assist you with, please give us a call at 701-328-0707, and we'd be happy to assist you with either your questions or concerns. And if we're not able to answer those questions for you, we'll make sure that you get contact with the appropriate team members to make sure that your questions are answered. The Department of Operations Center is available 24/7, 365 days a year, and that phone number again, 701-328-0707.
And thanks, Sheri. And so just to be completely clear about that, the original contact points are the places you need to go to, as was previously explained, for these types of situations. But if, in fact, you don't know where to turn to, the Operations Center will assist with that. And, of course, if there's any other level of support that occurs that's needed because your systems or hospital systems or clinic systems may have been compromised, we're happy to support with non-IT emergency response components as well as part of that. Well, now it's time to hear from you. And so if you would just go ahead and unmute your microphone and please direct your question just to the panel. Please don't direct it to individual panel members. And then the panel member that feels that they have a response to that question will go ahead and volunteer a response. Does anybody have a question or comment? So while we're thinking about that, one of the things that I want to just direct to the panel is that just to kind of reinforce, I know I heard it, but why is it important for us to share information? Because I think, frankly, as I've had discussions in preparing for this, I was a little bit surprised at everything that happens when information is shared and what doesn't happen if it isn't. So does anybody on the panel want to respond to the question, why is it important that we share this information? Go ahead, Darin.
Yeah. And Tim, I think the reason that that's important, there's a couple of reasons, but the first thing that comes to my mind with information sharing, I'm going to start before about why it's important, is that we have this challenge with cyber incidents. If somebody drove a truck through your facility's front door and stole your files, nobody would they would say that was a bad guy, they did something bad, and we wouldn't feel like we needed to keep it a secret. But when it's cyber, it's all bets are off. We don't want to share with anybody. But the reason that it's so important is, first off, from the state's perspective, if there's impacts to your facility and your ability in the healthcare context to provide care, the state has some resources and some ability to help. And so the sooner we can know, the sooner we can start marshaling those resources. So that's the first thing. The second thing that I think of with this is when it comes to a network, and this is a computer or people, the power of the network is the size of it, how you're connected, and that can also be the weakness, right? That's why if we have a cyber incident, we don't want it to spread across the network. But with the right measures in place, the power of that network is going to be, how can we take the little bit of information, now let's put it in this context of a cyber incident. If you reach out to the State and Local Intelligence Center, to Kyle, and say, hey, we had this incident, here's what we know, Kyle can take that information, or the State and Local Intelligence Center can take that information, and they're going to anonymize it, or we call it make it non-attributable, and put that information into a document that says, here's what you need to look at to the neighbors, right? So we can say, keep an eye on these IP addresses. We know that these are bad, or we know that they got into a system this way, so check your systems. So we really can look out for our neighbors and make sure that they're not going through the same thing. It's going to keep our citizens safer, our citizens healthier, and that's really the most important thing, right? That's the bottom line. How can we keep people safer?
Thank you. Any other comments to that? Let me turn to the group once again and see if anybody has any specific comments or questions you'd like to raise.
Yeah, if there's no other questions there, Tim, I'll just kind of add on to what Darin said there too from a state response side. Our anti-malware software we have really spread out throughout our entire state network is one of the best ones we have out there in the industry. So it gives us the ability, as a user is noticing something suspicious happening with their computer, we can actually isolate it and pull that computer off the network. We could still communicate with it, but across the network, it's pretty much, as Natasha said earlier, immutable. They can't do anything else with that computer. So if that user would have, let's say they have administrative rights to other servers, well, now you just eradicated that. You move that threat off to the side. They can't spread across our state network at that point. So that is where it's paramount to report those things, share that information as quick as you can. And then we do have, even from a state side of things, with multiple states, we have a joint sharing analysis between, I think, 10 to 15 states now. So as they see something coming, maybe from the state of South Dakota, they can let us know ahead of time, hopefully before anything happens here within our state too. So that collaboration effort is a tremendous asset, I think, for what we've developed here at the state.
All right, thank you.
Yeah, if I could just add one short statement on that. So one thing we talk about sharing, and a lot of times it might feel like it's like we're just saying, like, when it's at its worst, it's like you've experienced this, this terrible, terrible event that's, took everything down. Like, it doesn't necessarily have to be like that either. It could be a more minor cyber incident that potentially you were able to isolate. You stopped it before it was something worse. And you may say, like, hey, mission accomplished, we're good. That information for me is really, really important, because I can look between, the network of fusion centers, federal resources, databases, at that thing that was stopped. I might be able to bring you some context that says, yep, you stopped it, but here is what it was, and this is likely what it would have led to, and this is the TTP that they were using. Here's what they often do that's been observed in all these other places, and this is how you might harden yourself to prevent that thing from happening again. So it isn't just sharing if it's like you need to notify everyone because it's really, really bad. I want to know about the times that you've got wins, because we can get additional context, and then we can potentially protect those other entities, those neighbors of yours, so it doesn't happen to them either.
Great, thank you for that. Any other responses to that question? Any additional questions or comments? So one of the things that I'd like to ask, and we're rapidly running out of time, but I do want to get any kind of feedback from the panel about, and this is just from my perspective, over the last 15 years we've spent a lot of effort developing an emergency preparedness and response process for public health and medical, and I think that we've made some remarkable progress, but we've not really kind of addressed, in my view, these more current threats in terms of what the impacts are, and so I haven't sensed the same level of community as we've done planning within the public health and medical environment and collaborating with emergency preparedness and so forth. So what are some of the steps that specifically for the public health and the medical sectors that you might say we should be considered taking as we start to move forward with trying to build our defenses and improve our responses? So I'd be particularly interested in hearing from anyone that may have a comment about that, but I'm wondering if there isn't a role for us as we have within the hospital preparedness program potentially. And for those that aren't familiar, hospital preparedness, it's a federal misnomer. It's not just hospital, it's all the private medical sector that's contained in that program, to maybe begin to do a better job of focusing on some of those planning activities and see with the partners that we've just brought in and had some presentations from today to start to incorporate into a more formalized process to make sure that that is in fact getting provided for within our bigger planning structure. I know that we've got very strong attendance today in today's participation, and as usual, the majority of the facilities will also take advantage of the archived version of this as well. And so I'll remind you about that in just a moment. Well, actually, I'll do it now. So anyone that has an interest within your facility can access this program by going to hhs.nd.gov/ET, and there you'll find an area that talks about webcasts and training, and you'll find a copy of this that can be streamed. So I would encourage you to share this information with the rest of your staff or management within your facilities. That has exhausted our time together. I want to turn to Darin Hanson with North Dakota Homeland Security and see what closing comments you may have, Darin.
Thanks, Tim, and I guess I'll start with some gratitude and just say thanks for the opportunity to be here, and thanks to everybody out there in the healthcare and public health realm. It's been a tough few years, but I really appreciate what you guys do to make it better for all the citizens here. You know, we live in a world with great power competition with China and Russia. They have all these resources. We know that China has a huge data collection program, but it's also the asymmetric element of cyber attacks that make it so difficult. You know, a small country, North Korea and Iran, or even criminals can do just as much damage to us as the big guys. And so it's so important that we work together. We got to figure out ways to share information, share the right information with the right people at the right time. It's got to happen quickly so it's valuable, and that's going to take a lot of work. And really, I think as we go forward, it's just continuing to build on that public-private partnership that we need to do. And I know the State and Local Intelligence Center is more than happy to be a part of that, as am I at the Homeland Security Division. And I think I'll just close with that. Really appreciate the opportunity to be here, Tim.
Thank you so much, Darin. And thank you for your participation today. Look forward to, as we have our regularly scheduled monthly meetings and some of the other planning meetings that are going on, we'll start to incorporate this component into those activities as well, and continue to reach out to the partners that you saw here and others as we continue to mature that process. Once again, thank you so much for your participation today. Take care.